The view that I'm covering now would be the A to P open mouth view. And before I start going over structures, the first thing that I want to discuss would be how the film is taken and in which direction is the film read. This film is typically taken anterior to posterior, A to P, and it is read P to A or posterior to anterior. Now the reason that we take this film A to P is because that gets the object that you are looking at closer to the film, and you always want a decreased film object distance. When you read this P to A, you are basically reading it the same way that you would be identifying the patient's left side and right side. So this is called patient-doctor orientation, so that the patient's right side is on the doctor's right side. As we're starting this film, and this is the film that is labeled the same way as Yoga Monroe. As we start this film, number 1 right here, and it goes all the way up to right here, goes all the way down to right here, all the way in to right here, and all the way up to right there. That is the lateral mass of C1. All of that is the lateral mass. And so that is number 1. Number 2 is actually identifying this structure that is going across, and it starts right here and goes across like this and like this and like this and comes down right here. Number 2 is the anterior arch. It kind of goes up into a frown position, if you will. Whereas the one that is coming down like this, more like a smile position, number 3 is going to be the posterior arch. And so number 3 is the posterior arch, goes all the way up here to the lateral aspect of the lateral mass, crosses over and superimposes part of C2, and up to the lateral aspect of the lateral mass on this side. So that is the posterior arch. Number 4 is labeling this oval shape right here, which is the transverse process foramen of C1, and you notice that the foramen itself goes all the way out to right here, and here is part of it coming in right here, and so we just barely can see part of that foramen right there, and so that is number 4. Number 5 on the other side is labeling the transverse process, and again it is all of this going out to here, and here's the top of it right there. But all of that is the transverse process, and right here this dark area is the transverse process foramen. Now, number 6 in the book is labeling the occipital atlanto joint, and the joint is this space that is right here between this lateral mass and this occipital condyle, and you can just barely see this little dark slanted articulation. That's that space that is between C1 and C2, and so it's just a barely slanted, dark, thin dark, right along right here. If I go over to this side, you can see it just a little bit better, that it's that little thin space, that little thin dark line right along right there. Okay, and so that would be the occipital atlantal joint, whereas right here between C1 and C2, this space right here would be your atlantoaxial joint right here, atlantoaxial joint. And so that is the space between C1 lateral mass and the top of C2. So that was number 6. Number 7 is out here in this dark area, and it's actually labeling the mastoid process. Doesn't really show up very well on this film. It will be a cloudy, bubbly look because the mastoid process has a lot of air cells. Number 8, easy to see. Number 8 is the odontoid process. Goes all the way up to here, and of course here is the other side. So all of that is the odontoid process. Number 9, which is this white density right here. Let's go to the other side, just beyond number 10. This white density right here is the pedicle of C2. And then number 10, you see a density change right along right here, across. That is the top of the lamina portion coming into the tip of the spinous process right here, and then the top of the lamina portion right here. So we do have vertebral body by itself here, whereas we have vertebral body and lamina right here. So number 10 is labeling the lamina of C2. Number 11 is labeling the spinous process of C2, which is sort of an upside down heart shape, and so it's going all the way across right here, and there would be the tip, down here would be the bottom. It is bifurcated, and so that is the spinous process of C2. Number 12 and 13, we see that when you drop down from the top surface of C2, it kind of goes out like this. That is the transverse process of C2. And right here, right beside of the number 2, it's dark again. That's the TP foramen. So number 12 is labeling the transverse process, and number 13 is labeling the TP foramen. But here again, this side is the easiest to see. All of this is the transverse process. It's superimposing part of that tooth. And right here where it's really dark, right to the right of the number 2, is the TP foramen. Number 14, this would just be the mandible, labeling the mandible right here, and of course the mandible goes all the way down and all the way around. The number 15, which is labeled right here, let's go to this other side. Right through this TP, you see this density change coming down right there. This structure that has added density right here is actually just the edge of the tongue. So 15 is labeling the tongue. And then number 16, which is the last one on this film, number 16 right here, if I go to this other side, showing it on the other side, that is the jugular process right there. Jugular process is right there. Now, a couple of things that's not numbered on this film is that when you look at this density change right here, sort of a half circle, right along right there, that is the foramen magnum, right there. And we also see the 2 front teeth, and there's the gap between the 2 front teeth. So there are the 2 front teeth. And then you see a density coming down like a V shape right here, and that is the EOP. And then there's another density that's going up right here, coming down right there. That is the IOP. We do see this molar right here, and we see this molar right here, so I don't want to confuse the molars with the occipital condyles. Condyles fit really tight to the top of the lateral mass. Molars are usually outside beyond the lateral mass. So if you're looking at something rounded, you're not looking at the condyles. Again, condyles fit really tight to the top of the lateral mass. This is a molar. We have down here an impacted wisdom tooth. You see how the teeth root is coming out right here, and so it's coming in sideways. That is called an impacted wisdom tooth. And I believe that that's everything that I usually point out on that film.